Okay, I think we are on live now.
Okay.
Justin, can you unmute yourself?
Yep. It looks like we are live. Are we okay?
Yes.
Okay. I think we are on live now.
Yeah,
I think we are on live now.
Oh, okay. Sorry.
Okay.
Justin, can you unmute yourself?
Okay.
It looks like we are live.
Okay, perfect.
Are we okay?
Yes.
Wait,
We are on live
we're getting
now.
feedback from somebody.
Okay. Somebody, if you like now playing the YouTube, mute the YouTube.
Yes.
Yeah.
I'm muted. We're good. Just to be clear, we have 3 viewers that are us.
No, there's a Sehi, Kim Sehi joined.
Oh, thank you so much for joining.
He said, nice to meet you.
Okay.
Hmm.
It's funny. I'm not seeing the chat, so honey. Are you seeing the chats?
Yes.
I'm looking, sharing too.
Okay.
안녕하세요.
Okay. All right. Also, Eric, just so you know, this isn't necessarily a highly participated YouTube channel, so please don't disappoint it because I know you have
No.
tens of millions
It's
and
fine.
millions of Instagram followers.
No, it's completely fine.
I don't want you to be so.
So our proposal is making fun, informative, and we can enjoy something.
Yeah.
Oh, still, honey, I don't want him to be disappointed. Okay. Should we get started?
Yes.
Yeah, sure.
Yes.
All right. So first off, thank you everybody so much for joining us tonight, today, this evening, wherever you are in the world. We are very fortunate on this wonderful day to have with us some wonderful, incredible plastic surgeons at the table. Starting with, first, I'm going to introduce Dr. Cho, who is based in Korea, who is going to be co-emceeing with me tonight. Dr. Cho, will you give yourself a little bit of a brief introduction?
Yes, I'm Dr. Jo, plastic surgeon, South Korea. Our clinic, I have one clinic, inclined plastic surgery, and I have expertise doing breast augmentation and facelift and eyelid surgery. Nice to meet you.
Nice to meet you.
Nice to meet
Great.
you.
Thank you so much. And also, just to be clear, we are a very international YouTube channel. So
Yes.
don't worry. If you only speak 한국어, 괜찮아요. Go ahead and type in Korean.
안녕하세요.
English, no problem. Espanol, no problema. So we're okay. But
Claro.
now, to kind of focus on our guest doctors that are visiting with us, we have Dr. Kelly Kim from Korea and Dr. Eric Hansen, who is from Mexico, both located in Ghent, Belgium. And I'm gonna.
So it's a 9 p.m. in Korea, right? But it's
Yes.
about 2 p.m. It's 2 p.m. here.
Sure, yes.
Yeah, so it's 2 p.m. So let's start with Dr. Hansen. If you could give a brief introduction and some background so we can get to know you for the audience.
Yeah, well, I'm from Mexico, from northern Mexico, but I'm living right now in Mexico City, where I did all my training. I did my training in general surgery and after that plastic surgery. And here I'm in Ghent doing a microsurgery rotation. But so that's about it.
And just to be clear, your Instagram, what is your Instagram handle?
My Instagram is dr.eric with just a K, HV.
So later you can look him up and become one of his tens of millions of subscribers or followers.
Maybe not millions, but yeah.
우리 닥터 에릭이 엄청나게 팔로우가 인스타그램에 많거든요.
He's not only handsome, he's also very popular. Okay.
Yeah, yeah, exactly.
And so next, Dr. Kelly Kim.
Should I introduce myself?
Yes. So maybe.
Hello, everyone. I'm Dr. Kelly Kim. I'm the owner of this YouTube channel. I'm a board certified plastic surgeon based in Korea, but here now I am in Ghent for a 3 months fellowship. I'm mostly focused on the gender affirming surgery. So I'm doing fellowship with Eric. That's why I invited, because one of the beauty of the fellowship, you meet the global plastic surgeon and you can share your experience and knowledges. So I think it's going to be a good opportunity inviting him to here and sharing like different situation in different country. So this is it. Thank you so much.
Yay! Thank you so much to our wonderful Dr. Panels and our guest MC. And Dr. Kim, would you like to start and open us up a little bit with some background on plastic surgery generally?
Okay. So I'm going to share ISAP's statistics, but if you want to add anything,
No,
you can
it's completely fine. So ISAPS, it's the International Society of Aesthetic Plastic Surgery. So it's like the most common or the biggest international society. So usually, like all the data we use in plastic surgery internationally, it comes from ISAPS.
So this statistics is for 2020. So actually, this is the recent one.
Yeah,
2021 is not yet published. So let's see first, we're going to see the number of plastic surgeons by country. So Mexico,
it's number 9.
Number 9, and South Korea is number 5. So interesting thing is Mexico has more, I think, bigger population. You know how many people live in Mexico?
Well, I think the latest census is 127 million. And Korea, it's around 30, right?
Yeah.
30, 50. Okay. Yeah. So it's quite a difference. So it's much more plastic surgeons per capita than in Mexico.
Oh, in Korea. Right?
Yeah, in Korea. Yeah. So
is it more competitive to become a plastic surgeon in Mexico?
Well, it's hard to compare to Korea. I'm not really sure how competitive it is to get in plastic surgery in Korea, but yeah, in Mexico, it's usually really competitive. I would say it's one of the most common specialties that medical doctors or students want to get into, but one of the fewest who can actually get there. So like from subspecialties, because in Mexico you have to do general surgery first. So from all subspecialties you have, I think it's the most competed one. So
in Mexico, to become a plastic surgeon, you need to do the 4 years general surgery.
No, at least you need 2 years. So usually it's 6 to 7 years in Mexico to become a general doctor, which includes 1 year as internship, and we have also still something that it's called like social service. So when you finish your internship, they send you like to a rural part of Mexico, and you're like a general practitioner there. So you still don't have like a license to become a medical doctor, because you have to finish this year to get your license. But they give you like a temporary license, so you can practice there, and you attend people in rural areas.
So after that rural service, and then you start training.
You apply to well, if you want plastic surgery, you would have to apply to general surgery, and since the second year you can apply to plastic surgery. But every plastic surgery training it's has their own way of applying. So some of them accept second year, some of them you have to finish and all your general surgery specialty. So it's a little bit different. And
yeah, I think the situation is different in Korea. Dr. Jo, can you explain the training system in Korea?
Yes, in Korea there's 2 years of pre-med and 4 years for medical school, and after that we get the examination for medical certification. So after that, we gonna be a doctor first, and then we gonna take a 1 year internship, and we apply to some part. And if I want to be a plastic surgeon, and I apply to the plastic surgery and reconstructive surgery, so we gonna 4 year. It depends on the department, 3 to 4 years. Plastic surgeon should do a 4 year course, resident course, and after that we apply for residency examination, and after that, we're gonna be a plastic surgeon.
So interesting thing is in Mexico, doctor has to serve in rural part of area.
Yeah.
I think it's similar with Korea, like a military
Yeah.
service.
Yes, but it is different. Every man, male doctor go to a rural service or the military service for 3 years.
Yeah.
So not in female, but in Mexico, female and male.
Yes, they have to
Oh.
do the social service, and it has nothing to do with the military. Yeah,
I see. That's the difference.
yeah.
There is no such requirement in America, right? There's no. So American plastic surgeons don't have to be socially minded.
No.
But there's a program like some doctors they getting a tuition from the military. That means after they're trained, they have to work for the military for a while.
I see. Wait, so I'm curious. So then, as somebody, so Mexico, you have to do these 2 years of social service. Korea, you are forced. The men have to do military service, and if they're doctors before, they have to do kind of social medical-ish stuff. Do you think that has a impact on the doctors that are coming out from it, like a positive or negative impact, or is it like, it's just 2 years of time gone?
Well, it makes it just 1 year of social service, but yeah, it's something that everybody has to do it. There are some possibilities that you can apply to work as in an investigation program, or maybe in like a city clinic, but usually, like I would say, maybe more than 90% of all medical doctors would go like to a less populated area, or where the economic status is usually like lower, to work in this kind of clinics.
Dr.
What about
Korea?
Dr. Joe?
What do you think? The 2 years of military service as a doctor, helpful, not helpful?
3 years. It is too long. It is too long for me. But there is difference. I heard that the social service is before the residency, right? In Mexico, right?
Yes, it is.
Yes, but we just after. It depends on the examination result. If I fail the examination, I should go to the military service. But if I pass the residency examination and internship examination, so for me, I just finished the residency, and after that, I went to the for military services for 3 years. So I think that Mexico is better because it is shorter than Korea, and I think if I were doing the kind of a social service before residency, maybe I would be. It could be a very good opportunity to take care of the poor patient or rural area. So after residency, I worry about my career. So too long, 3 years, and after residency, I cannot do my expertise. I treat the diabetics and hypertension. In me, I'm plastic surgeon, but I have to do that kind of medical service. So it has a difference, what I have to do and what I can do. So in my feeling, I have to take some trips or learn about the computers and take hobby. So I think it is too long, and the time is not good for medical career.
So actually, a lot of Korean doctors, while they're in military service, they play a lot of golf.
Okay.
Doing the hobby. But actually, I think as a government perspective, actually like sending doctors to rural area is allocating medical service, right? So as a government perspective, because the doctors finish the residence training, actually they can use more trained doctor. So
Yeah.
pros and cons.
Well, yeah, I think mainly the reason in Mexico that we still have to do this social service is that it's just cheap labor. Because
honest
oh, really? Because in Mexico, during your social service, you're supposed to be provided with a housing and a place to stay, but usually this is not true. So you will not have anywhere to sleep or at the clinic or whatever. And what they pay you a month, it's around $100 for 1 month. So actually, it's really cheap labor. So that's why, you know, we still have it, because actually, like, not many doctors want to go to these rural parts, and some of these parts are not really safe, and there's a lot of how to say, hostility, and could be dangerous in some parts. And so yeah, it's a way to obligate people to go there and have a health system, but actually I don't think it's good for us. Yeah, obviously you gain a lot of experience with treating patients, but I don't think it's the way, and I don't think it gives a lot out to our education. And yeah, you know, in a romantic way, you could say like, oh, it's so nice to do any kind of social service. But still, I think a lot of the patients who are getting the service from us are actually not really thankful, and they're really demanding. And
okay. So just to be clear, Dr. K.H. Kim TV's guests and their political and personal views are not necessarily those.
Yeah, we're changing a little bit from the principal topic, but yeah.
but thank you. I think that's all really interesting. Maybe we should edit some of that out later for Eric's own well-being.
Okay. I'm sorry.
No.
I don't want to get you in trouble with the Mexican government.
Away. My
just as long as you
inner
know
frustration.
Yeah.
So let's back to our original topic.
Yeah.
Can you be a center?
Yeah.
Like a little bit more.
Okay.
this side. Okay, let's go. So this is also from the ISAP's statistics. If you look at the top 5 surgical procedures worldwide, the first one is breast augmentation, and then it followed by the liposuction, eyelid surgery, rhinoplasty, and abdominoplasty. And top 5 non-surgical procedure is, first one is botulinum toxin and hyaluronic, those kind of thing. We can talk about that later too. Okay, let's see. And number of worldwide plastic surgery procedure, still the breast augmentation ranked first one. So that's why we're going to talk about it. And actually interesting thing is, this is 2020 statistics. If you look at the numbers, total plastic surgery procedure decreased by 10.9%. So I think it's an impact of the COVID, and especially the breast surgery decreased like by 15.9%. But actually looking at the like a non-surgical procedure, it increased by the 5.7%. So I want to know is same situation in Mexico and Korea too? Okay, That's it. That's the introduction. Justin, can you host it?
Yes. Don't worry, I'm here. I'm watching. So thank you, Kelly, for sharing all. That's all really interesting. I wonder if it's a COVID trend or if it was just a trend. Like if the data picked up on, you know, as COVID was happening and it pulled from that data, because 2020 data is from 2019, and 2019, the end of it is when COVID started, right?
Yes.
So I don't know if that data would have been inclusive of COVID. Finally.
Yeah, maybe not. And usually, well, at least in Mexico, when like all aesthetic surgery stopped, was between, I would say, March to like June, at least. Plastic surgeons will start to like regain their practice in around June.
Yeah.
So yeah, June 2020.
Yeah, that's what I was thinking.
Yeah.
So you cannot do all the cosmetic surgery.
No. Everything was free. So especially for like big surgeries, like where you need to have intubation and all that, because you know there was a lot of uncertainty about COVID.
Okay, well, thank you for sharing. We're gonna keep moving on, and Dr. Cho, you're gonna help lead kind of the next segment. Take it away.
what I have to do.
Yeah.
I was
Number
thinking
two-
about the
number two
Korean
question.
situation.
Number
I was
two.
thinking about the Korean situation because
Oh.
in Korea, it compared to the Mexico, actually
Mhm.
cosmetic surgery was a little bit grown. I think the 2020 because of the every people cannot go out of the country, so they want to spend their money for their self. So I think that the trip or plastic surgery is competitive. So if we cannot go to the trip,
Oh.
many person try to doing non-surgical treatment or the surgery over because of the industry shutdown and do not have to go to the farm or the vacation. It kind of some lockdown, so they try to doing the surgery that delayed or planned surgery. So I heard that it was very boom over the many local plastic surgeon clinics. So I heard that it was pretty good. I heard that.
So actually, there's just statistics. Which business is actually doing better during the COVID area? So he said, Dr. Joe said, actually, plastic surgery is actually doing better than before, like during COVID. How is it?
I think also in Mexico, you could see this. One of the main concerns for patients having surgery is recovery. So if you don't have to go to work and nobody has to see you during this time, so it's more appealing to have a plastic surgery because you can be just working from home or just staying home, and you have not any worries that somebody will see a bruising or maybe you cannot move that well or whatever from having any kind of surgery. So in that way, I think, and also like Dr. Cho said, also the people were not traveling that much. And also, like, for example, people, since you are at the home, you're not buying luxury goods or clothing and all that because people didn't go that much out. So the need to buy things and eating out and everything, all that goes down. So you have more money to spend in plastic surgery.
Yeah.
In a way.
So just so Justin, what about F&B, restaurant business during COVID?
Oh, we died. It was painful. Like there is no other than the fact that delivery actually started going up, which is great for the third-party delivery companies, but horrible for the restaurants.
Yeah, I've heard.
It's been COVID was very painful. But what was that though? Like globally, like in America, I know, and I think in many parts of Europe and across the globe, what is that when it's non-required operation? What's the term?
Non-emergent, so elective operation.
Elective surgery.
So all elective surgeries were cut, I think, at least in America. And breast aug or any cosmetic procedure, that's an elective surgery, right?
Yeah.
So
actually, yeah. In Mexico, we have a lot of private clinics. So during maybe March to May, I think all kind of surgeries were mostly shut down. But then you had all these small clinics where they started doing surgeries because they only attend cosmetic surgeries. So people were getting tested to go to the clinic, and in that way was safer than going to a hospital where sick people go and you have COVID patients there, and doctors tend to see more patients, and it's a higher risk of getting COVID. But so in private practice, they started quite earlier than plastic surgeons that work in hospitals.
Actually, Kyori, what happened in Korea?
So in Korea, we never stopped elective surgery.
Okay.
All the elective and emergent surgery just going on during the COVID. I think that's, Korea did a very good job in COVID preventions. Actually, I think that's one of the things.
Because I think there were doctors, I remember during that time, globally, they kept asking you, Kyori, so how's Korea? You guys are still functioning, or we're planning on reopening elective surgeries. How did you guys open again? You're we never closed. Right?
Yes.
Yeah.
Mm.
All right. Just to kind of move on, because we do have some like topics we want to cover. I'm gonna go ahead and jump to the second topic.
Mhm.
And then, Dr. Cho maybe take over the next one. But
Yes.
so we're focusing on breast augmentation. How popular is breast augmentation in Korea versus Mexico? Because we saw from the data globally, I'm kind of surprised that breast aug is the biggest cosmetic surgery.
Mhm.
I thought that was interesting. So just between the two countries, let's start with Mexico this time around. Like,
Okay.
how popular is breast augmentation in Mexico?
Well, it tends to change between years, but like mainly the most two popular surgeries are liposuction and abdominoplasty, and usually they are combined together. So it's hard to say, but in Mexico we have a high index of obesity, so that's why I would think that this is like most common elective surgery. And in third place, you usually have a breast augmentation and sometimes rhinoplasty, but it still depends. But we tend to do around 60,000, I think, surgeries per year. And also, I think in Mexico there's a high registered procedures,
Mm.
because we have a lot of like clinics, and some doctors only charge with cash, so they don't report as many surgeries as they do. And so we have a lot of you could say under the water, like or many surgeries are not being registered. But yeah, like I would say the statistics are usually like that. Most common it's liposuction and abdominoplasty.
Uh-huh. Uh-huh.
Then only plastic surgeon can do liposuction in Mexico.
Yeah, well, legally yes, but we have a
Legally.
lot of intrusion from other specialties, or even not specialized doctors, and just general doctors taking this like surgery course that it's online or in this like fake
And
universities.
is there any restriction for the surgery or treatment for the specialties?
Well, legally, I don't think there's any restriction. So like a patient would have to sue after a procedure if something went wrong, but actually it's not really well controlled. So it's a big problem right now in Mexico. So we have these like pretend plastic surgeons doing this kind of procedure. So sometimes they have a high mortality, and now they're starting to change the laws, so only plastic surgeons can do the surgery. They also trying to approach via anesthesiology. So if you're an anesthesiologist, you would not give anesthesia to somebody who's doing like any surgery intrusion or something like that, but it's also like hard.
Mhm.
And since we have a lot of small clinics and private clinics where it's hard to control them because they're not like main hospitals. So yeah, it's kind of hard, but yeah, we have that kind of intrusions.
So because I think Dr. Cho is working with the Korean Association with the plastic surgeon. Actually, he's working on like a social campaign.
Okay.
When you get a plastic surgery, you need to check up the
Yeah.
plastic surgeon is board certified.
Yeah.
Dr. Cho, can you introduce about the campaign?
We are talking about that if you want to take a cosmetic surgery or treatment, you should confirm he or she is plastic surgeon, because plastic surgeon is have expertise doing the cosmetic procedure and taking care of the soft tissue and handle over the complication after treatments.
Yeah,
But
sure.
in
Sorry to interrupt. Oh, no, go ahead.
In Korea, many general practitioners, it is GP, has a very big portion of the cosmetic procedures, liposuctions or botulinum toxin or fillers. So there are many doctors that have other specialty and doing that cosmetic surgery because of the money. As you know, the insurance constricted the budget of the total medical expense over the country, so they asked to the non-insurance and variable cosmetic treatments. So it is it happens a lot of problems. There are complications or death problems. So our association try to have a PR over the people that please check he or she is plastic surgeon.
Oh, we have a new guest.
Hello.
Dr. Ko, can you hear us?
I was like, who is that?
Dr. Ko, Dr. Ko.
I know that's Dr. Go. I just couldn't tell.
Hello.
Oh, okay, great. Who are you?
I'm just arrived, so I didn't any prepare for the video Zoom, but I want to attend the meeting.
So 괜찮아요. So Dr. Go, can you please introduce yourself? Just a couple minutes, like really quick.
Yes, really key. Yes. Hello. My name is Dr. Ju Young-go from South Korea. I'm a plastic surgeon, board certified plastic surgeon. My main field of surgery is breast and body contouring surgery and some kind of minimal invasive surgery. Nice to meet you.
Hello, nice to meet you.
Great.
So
thank
Dr.
you.
Ko is owns her own private clinic.
Okay.
The name is Atelier. You know Atelier?
Yeah.
No, it's like a working space for the artist.
Yeah.
That's her clinic name.
Okay. Well, thank you, Dr. Go. So Dr. Go, just so you know, you already know the two people here. You know me, the handsome, the bearded handsome man next to Kyori. This is Dr. Eric Hansen from
Hi.
Mexico. So we're just kind of doing a compare between Mexico and Korea. And actually, Kyori, you now need to talk about breast augmentation in Korea.
So I want to talk about how popular breast surgery in Korea. I don't think it's number one because Korean patients, they did a lot of facial cosmetic surgery first. I think almost the number one is the double eyelid surgery, which I got.
By the way, just to be clear, when we first met, she told me she didn't have any operations done. And then later, she's like, oh, I had eyelid surgery. And I'm like, what? You said you didn't have anything.
Just a small thing, yeah.
Yeah, just a small thing. Yeah, not a big thing. Okay, sorry. Go on.
Okay, but so unfortunately, we don't have numbers. So if you look at the ISAP's statistics, actually Korea doesn't have a number because they didn't include the country, didn't offer sufficient number of data. So I think that's the problem. We don't have anything, but you know, I'm from Korea, Dr. Cho and Dr. Go from Korea. We especially focus on the breast surgery. So that means there's a demand for the breast surgery. Dr. Cho, why we don't have statistics?
Actually, there's under the water. There's a problem with the text, or I mean that because we are mainly doing breast augmentation at private clinics, so that can be the problem. As you know, that there is a new legal change, and that we after maybe September this year, we should registration of the implant for the to the KFDA, Korean Food and Drug Association, right? Okay. So that I heard that the 20,000 per year is done in Korea. I heard that, but that is not correct because that it is from the manufacturer of the breast implant, because every medical device should be registered to the country. So maybe someone will know about that statistics, but maybe they do not open the data.
Yeah, I think that the best way to get the real statistics would be approaching all the different brands of implants that in each country they sell, and to see like how many implants they sell to like any amount of surgeons or hospitals. because usually surgeons, they don't care about their statistics. So they're not like having a record of how many surgeries I do and what of any kind. And like, for example, I don't know in Korea, but in Mexico, the most common procedure to be combined, it's breast augmentation. So like we have this really big trend that it's called like mommy makeover. So a lot of females, after being done with their pregnancies and when they don't want any more kids, they would go and have this procedure, which is like an abdominoplasty with like abdominal wall closure, and the liposuction, fat transfer to the buttocks, and breast augmentation. So that's the most common package procedure, if you can say that. And always like if the patient is having something done, the most common request it's breast augmentation. So I don't know if those registrations goes as two different procedures, or they register it as liposuction and they don't register the breast augmentation. So it's hard to say.
So Dr. Ko, you specialize in breast and body contouring surgery. What do you think about mommy makeover trend in Korea?
Mommy makeover trend is very increasing now because before the Korean people very afraid of abdominoplasty, because abdominoplasty is not a simple surgery, they think, but nowadays they they think a tummy tuck surgery seems more easy and simple surgery for the women. So they are more. I think the rate of the mommy makeover is very increasing now. So usually I recommended not liposuction or combined liposuction and abdominoplasty. I recommended more than before nowadays.
Okay, interesting. Well, thank you. Thank you for the trends about breast augmentation in Mexico and Korea. It sounds like they're both countries have a lot of hidden numbers. And seeing how we have so many private practice doctors right here, I'm sure there's so many secrets they could share later. Like, why is the number so hidden? But again, we can talk about that later. Dr. Cho, could you move on to the next question?
Next question about the most popular surgery in Mexico and Korea. Actually, in Korea, we have a lot of blepharoplasty, double eyelids, and the nose. So how about Mexico?
Yeah, in Mexico, it's liposuction and abdominoplasty the most common, and followed by breast augmentation, I would say. Yeah, and
what about next, Justin?
Yeah, I got this one because actually I thought it was very interesting when you were talking about Mexico abdominoplasty liposuction, because even from the Western standpoint, you know, Latinos or Latinas, we imagine they're very curvy, right? We imagine it's very natural, but after hearing you talk, I think maybe there's just a lot of plastic surgery. But I'm wondering, like, in terms of size, though, for like implants between Mexico and Korea, like, what are like the most common, like, what is the ideal size for, like, say, the perfect breast for a woman in Mexico versus in Korea?
It's really hard to say, because I would say in your practice, you have two different kind of patients. There's a patient who have a concern about their breast size, but they want a natural result. And you have also people who, you know, they don't mind if that they look like they had a plastic surgery or they have a breast augmentation. So you have these different kind of people. Usually when they want a natural result, you would get maybe from 150 to like maybe nearly 300 cc's, which would increase something like 2 cup size, you can say. But there are some patients who request having maybe 3 or 4 cup size up. So it's really hard to say like what's that desired, because it also depends a lot of the thorax and like physically how the patient is. In Mexico, usually women tend to be shorter than, like, for example, in the US or Europe. So if the person is shorter, the thorax will be smaller, so the breast implant would not have to be that big. As for example, here in Belgium, that usually women are like really tall and around 170 to 180 centimeters, so the thorax will be bigger, so the base of the implant should be bigger. So it's hard to say like what's the most desired cup size. I think it depends a lot on the female and what the patient wants.
So one of the thing is like doing fellowship here, the patient physically is so different. Here, the females are very tall, but actually they are slim. I don't think their thorax is wider.
No.
Very slim but tall. So actually, but Korean patient is different, Mexican patient is different. So like that's also like a body shape difference based on the ethnicity is also interesting.
So I'm so sorry. I'm not a doctor. I'm the only one not a doctor here. I thought
You're representing patient today, Justin.
So, Laura, what is a thorax? I thought the thorax was like here, but it doesn't seem like it's here. Where's
no. The thorax is the chest, but all the chest cavity.
I see. Okay, that makes. I apologize.
Thank you, Justin. These kind of thing. That's your role.
Yeah.
My role is to be the one that doesn't know. Okay, great. Thank you.
Okay.
So actually, while we're still on Eric, is there a particular implant that, like within Mexico, a brand that tends to be more popular than others?
Well, in Mexico we have so many different brands, I think, but it's hard to say because of the numbers. I'm not sure which is the biggest, but I could say that the most increasing brand in Mexico, it's Motiva, which is from Costa Rica, and I also hear that in Korea it's one of the most popular brands, and in Mexico it has gained a lot of popularity among plastic surgeons.
So just to be clear, amongst plastic surgeons or amongst patients requesting for that implant to plastic surgeons?
Well, I don't know in Korea, but in Mexico, usually patients, it's hard for a patient to ask for a particular brand.
Mm-hmm.
They would ask the plastic surgeon, like, what brand would you use or what type of implant, or they want to feel it or whatever, if you have like samples in your office. But I've never heard of a patient like demanding to have any particular brand.
So interesting. Eric said in Mexico, decision-making power over the implant.
Yeah.
That's plastic surgeon has it. But what do you think, Dr. Joe?
I think that
what about the situation in Korea?
Yes, most Korean people who visit our private clinic, they have a preference for the implant. And it's two, one or two. So they rule out some brands. I never do that brand, and I prefer to doing that brand. Some brands. So I think that the many Korean patients look after search for the information about the first implant, and many Korean manufacturer advertise for the general people about their implant. So it is very interesting. It is different from other country, I think.
I think, Dr. Go, I'm very interested to kind of go a little bit deeper. Dr. Go, what is your experience? And
in my experience, about 3 or 4 years ago, that day we have many kinds of implant brands. Motiva and Elegant, Mento, Sabin, Polytech. There are many implants we can use, but nowadays we can use particular, especially 3 kinds of implant brand. Motiva, Mento, Sabin is possible in Korea. So before that day, 3 years ago, I recommended the kind of brand that fits for patients. But nowadays, patients can choose because there are not many options. So patient choose, I recommend, and we can modulate.
Mhm. So this make a decision based on the discussion between doctor and patient.
Yes, you're right.
Oh.
So my impression, it seems like in Korea, these implant companies have done a really powerful and very effective, like B2C, like indirect marketing to really
Yes.
influence, And so it seems like, especially because Korea, again, now and as an outsider, Korea is very brand centric. Brands have a very powerful place in Korea, right? Like Louis Vuitton's a Coach, and any big important name is very attractive to the market here. So it seems like some of these implant companies have really taken a very interesting approach to how they're marketing it. But Kyori, can you talk a little bit about what do you think is the most, like in terms of size? You have your own opinion, I think, from your experience. What is the most desired size or kind of breast augmentation that you've experienced with patients?
Okay, so I think it's the same answer with Dr. Eric, because you should look at the patient body, like patient preference. So I cannot say what is the ideal size, but what I want to say is, in your clinic, you have a breast implant, but you like stack storage like a popular implant size. That's why I don't want to know. So for me, usually from 250 to 350, that's the most I used size. So I always store that size of implant in my clinic. What do you think? What about you? If I ask like that?
Well, the something that also, it's our fault as plastic surgeons. Like we always talk about volume, but volume, it's really hard to say. You have to talk about the base of the implant. And usually patients come asking for breast augmentation. They're like, oh, I want 300 cc's because my friend got 300 and they look really nice, so I also want 300. But maybe his friend is really big and have a really wide chest, so 300 in her looks natural. But if I put 300 in a petite, will look more, more unrealistic result. So usually patients come with any idea in volume, but we have to explain, and I think that's our job when we talk to the patient, to explain that the volume, it's the result of two different measurements, that these two different measurements are the thing that affect most on the result, that it's the base and the projection. So the base, that's you have to measure that as a plastic surgeon, and the projection, that's what the patient would choose. So with these two measures, talking like the plastic surgeon with the patient, you will get the end result that it's going to be the volume. So at first, it's hard to talk about volumes. It's more about projections, but also like projection, it depends a lot on the different brands you have. And so also in that way, I think it's better, or like, well, that's just my opinion, to be custom with only one brand. The more brands you are working with, it's the harder like to have the more, how do you say, like, to have a more, how do you say, I forgot the word,
variation, or kind of
your results to be more consistent consistent result. But yeah, so I think it's really important to have a really good talk with patients. Nowadays we have all these different technologies where you can scan the body of the patient and simulate how it would look to have a certain size, and in that way it helps to communicate and to have a more realistic how to say, like result from the in the patient perspective. And because sometimes patients, it's hard for them to explain what they want, and like, for example, also like our way of talking, maybe the terms we use as like projection, maybe the patient doesn't understand what projection is, or like what's a thorax, or like all these kind of things. So it's really important, you know, to have a really good talk about with the patient, to have and meet their expectations.
Yeah, good thing is we have technology to make a better communication with the patient. I think Dr. Gu is using 3D scanner, right? Can you
Yes.
explain about it?
Yes, I use the 3D Chrysalix. Chrysalix is a very simple 3D simulation. It can just need a three angle folder front and then 45 degree side, and then we measure the distance of the nipple. That is enough. That can then only using the 3 folder and the nipple distance, and the program simulate calculate the breast width and projection and a volume, and then we can insert the implant imaginary, and then we can see the result after the insertion. So the good thing and the merit with Chrysalix, we can see the moving the when the patient walking, or patient lying down and up and walking, we can see the moving of the implant after the surgery. So we can discuss the size and the projection, so we can choose the patient, the implant and the projection.
Have you ever used Chrysalix?
Yeah, in our hospital, where I did my plastic surgery training, we had a Chrysalix open, especially like for reconstructive patients, but we also use it for aesthetic surgery, and yeah, there's also the Divine, which is also from Establishment Labs, I think, and well, we have both.
Okay, so the doctor and the question. So I've seen Chrysalix and other 3D kind of simulating, you know, post-op images, but I always wonder, like, so yeah, those are great. They can look really wonderful. Like a patient might say, I want to go this large or etc., get a feel for it. But that doesn't necessarily say anything about the surgeon's ability to make that result happen. So how do you close that gap? Because again, if my friend was getting a breast, a girl, if she said, oh, I want to get a breast, oh, I saw 3D simulation, my first point would be, oh, are you sure that doctor can do that though? How do you close that gap to make the patient feel rest assured, oh, don't worry, your results will be just like this or even better? What do you do? How do you explain that?
So actually my perspective, so when I started using the 3D simulation, a lot of doctors having that question. The result will be same with my result. What if I cannot make this result for my patient? But actually in reality, if you show that 3D simulation thing, still it's a 3D simulation. It's not natural. So I always tell my patient, actual result is much better than this. So actually surgeon can make a better result than the simulation. So I don't actually personally, my thought is I'm not worrying about it.
Yeah, well, in my opinion, I haven't used that much this kind of technology, but yeah, you always have to tell the patient that it's not to give a result that we're approaching. It's just for them to understand, if they like that amount, or what do they think that how do you say, like they are
it's more like giving a sense.
Yeah, a sense of how could you look, but because many surgeons have the question like, okay, if I don't give this result, maybe the patient would be unhappy and like, hey, you promised me to leave me like this, but I don't look like that, or maybe it's bigger or smaller, or I don't know. So it's just like, it helps for the communication. So in that way, you can tell the patient like, how do you think this looks? Oh no, I think it's still too small. Okay, so let's go a little bit bigger. Or like, oh no, that's too big, or it doesn't look natural. Okay, so we'll try to like change. So it's a really good way in communication with the patient, because sometimes our words are not the same as the words of the patient, or the patient just like asking something that we think we understand, but it's not like the same language sometimes. So by putting these images and this reconstruction, 3D scans and all that, it's a way in improve the communication with the patient. But you always have to tell the patient that it doesn't mean that her result will be equal to that. It's just to make a
get a feel for it.
Yeah.
I see. So I'm just curious for any of the doctors, have you ever had patients come in and say, like, I want 300 cc, like my friend got this, and I know it's gonna look great on me, and then you do the 3D simulation or something and you're like, oh, like never mind, like that was bad. Like you tell them, oh, that's not good for you, but they see it on the simulation and they're like, okay, you're right, I was wrong, I'm sorry. Like, have you ever had that kind of experience with patients?
Oh, sure. Yeah, for me, always. Like,
oh, really?
Patient has a number in their head, but actually with the 3D simulation and also the external sizer. Do you use external sizer too?
Yeah, we
with
have
the external sizer, they will like, oh, okay, this is not for me. Sometimes, yeah.
Okay. Dr. Go, any experiences? I'm curious because you do lots of breast augs.
Yes, of course. In my experience, the patient wants some implant, but they can 3D scan or external sizer. They understand that the size is not for me. So I recommend it and communicate it more, and I recommended the more profit size.
I see. And Dr. Cho, are you okay? You keep your computer kind of comes in and out. Just want to make sure you're okay.
Yes. Because
okay.
I'm okay.
Okay. So I am curious. Another question that we had was about preferred incision. Was there a preferred incision with breast augmentation in Mexico versus like in Korea? And all of you can chime in. All you are doctors.
Okay, like for me, my preferred incision would be submammary, like just hidden under the mammary fold. But this all depends in the surgeon technique. Like there are some surgeons that only go peri-areolar. There is very few who would do like axillary approach, I would think. In Mexico, I think in Korea it's more popular a transaxillar than in Mexico. But yeah, I think the most common, we don't have any statistics about this also in Mexico, but I would say like just by asking other surgeons, the most common incision would be underneath. But I think it's more of a the school where you learn to do this kind of surgeries, like how you were taught to do the surgery. But
and just to be clear, the hidden, that's the IMF incision.
Yes.
Is that right? Okay. So just
he's just semi breast doctor.
Yeah.
He knows everything.
Okay.
What about in Korea? This is great because we have a sample of 3 plastic surgeons, all who specialize in breasts and do lots of breast augs. What have you found is the most popular incision?
Should I say? So I think like 20 years, like 30 years later, when Korean patient got a breast surgery, they prefer the axillary incision.
Mhm.
But I think it also depends on the lifestyle. So at that time, Korea was very conservative society. They are not wearing many sleeveless clothes. But these days, the lifestyle changed. They are working out a lot with sleeveless, and sometimes they wear a dress, swimsuit. So for these days, axillary area is exposed area
Yes.
for Koreans, but before it was not. So I think that was one of the reasons IMF incision got more popular in Korea. For me, I preferred IMF incision because I had more control over the pocket,
Yeah.
over the incision, and fixating the inframammary fold. But also when I'm doing the consultation with the patient, I talk about the options. If their preference is important, but also their anatomy is important too, because
Obviously.
if patient inframammary fold is not definitive, it's not obvious, if you make a scar there, it will be more visible. So I think it depends on the patient preference, surgeon skill, and patient anatomy.
Obviously.
Dr. Cho, what do you think?
I think I have preference to doing surgery with the transaxillary with endoscope, because I think for Korean, I think it fits to the Korean person using transaxillary, because they do not, most of the people do not have definite IMF lines, and I think the reason why the IMF incision is popular in Korea, it depends on the surgeons, because many surgeons talk about that the as Kyori said, that the lifestyle is changing and sleeveless shows and the exercise is easily to expose. But in this year, underboob fashion is another trend. So I think that the
Sorry.
Yeah.
Under boob fashion. I'm in Korea. I don't understand what that means. What is under boob fashion?
I don't
Do you
know in
know?
English, but the exposure the lower breast with the clothes open. I mean that the clothes is just a very short.
So literally what they're wearing is they're wearing like not like this, they wear this. So they're under part of the
Okay.
Where are they wearing this? I haven't seen it. Where is this? Is this in Gangnam? Is this by your clinic?
If you turn on the YouTube and search the Korean idol girl groups, and you can see the many. So I think that it depends on the anatomy of the her breast. If she do not have a definite IMF line, maybe Dr. Shu said that it is not that much invisible in IMF scar. So you should worry about it ever lasts for a long time. In my aspect, the actual skin is more thinner and has already have a wrinkle, multiple wrinkles. So I think it is more invisible in extra, even it is exposed with the sleeveless clothes. So I prefer to doing transaxillary surgery with the unmarried female, and if she's already have a married and has a definite IMF line and a little bit have a ptosis over the breast tissues, I prefer to doing the IMFs, because I think IMF surgery is more controllable surgery, and it means that it is easy for surgeons. They need little acumen, and it is easy to doing that kind of surgery and the fast surgery. And if there are some complication after surgery, it is very hard to doing correct with the transaxillary, because then we should insist that you should do another incision in your IMF. Then maybe she will talk about why did you recommend doing surgery with the transaxillary.
Great, thank you, Dr. Cho. So this is very interesting because we have two female plastic surgeons and two male plastic surgeons. And even within Korea, it's two females. And just to be clear, in Korea, it's predominantly men that are doing the plastic surgeons. So I'm very interested now to hear what Dr. Go has to say about what she thinks is kind of the popular kind of incision, etc., from another woman's perspective as a plastic surgeon. Dr. Go, what do you think?
In my clinic, the patient, half of them want IMF and half of them want axillary incision. Already, as mentioned, Dr. Joe, there are unmarried women who want to axillary incision, and married women want to usually prefer the IMF incision. But I recommended usually not except some cases, I recommended IMF because IMF is a very control. It is control the asymmetry and some kind of the patient's problem. So I prefer the IMF incision, and usually the bra mark conceal the scar. So I preferred the IMF incision, and I recommended IMF incision more, except some kind of very, very flat hypomastia, except.
So funny thing is, when I read the underboob fashion article, I was thinking about the same. I always talk to my patient, IMF incision, nobody can see unless you take off your clothes. But now they can see even though they're wearing clothes.
Yeah.
So like, oh no, not this fashion.
So question, can you get the same results with an auxiliary approach as with the IMF? Everybody said it's more controlled with IMF, but I'm wondering, like, if somebody wants, say, a larger, kind of slightly abnormally large breast for maybe their butt, for their thorax, what can you get? Is it up to the surgeon's skill to be able to get the same results, or is it just there's certain results you can get with auxiliary approach versus IMF, or there's some you just can't do? Question. Yeah, doctor.
It depends on the breast. Ptotic breast, short IMF. I mean the distance between nipple to the IMF is too short, or have a tubular breast. It cannot be done good breast surgery with the transaxillary. In that case, I insist her that you should do IMF incision, even it is visible.
Eric, you were going to say something. I'm very curious. What were you going to say, Eric?
Oh, no. Well, you know, also this has changed a lot because back in the day when you had a big implant, you would need big incisions to put it in. But now with there has been a lot of improvement with the technology, with a cohesive gel. So now you can put in bigger implants through smaller scars. So this has also made a really shift in the desire or the most common incisions you use.
Mhm.
I don't have any experience in endoscopic or transaxillary approach. That would be really interesting. There are very few patients who would ask for a transaxillary. But well, I actually never had any patient who like requested to have a transaxillary. I don't have that experience in that kind of surgery. But yeah, I would say maybe a model that usually takes pictures like without clothes. Maybe that would be like a good approach, but still you have a lot of Photoshop, so you can like Photoshop the scar or whatever. But yeah, it's hard to say, and also I think that sometimes when you try to do smaller scars, you're always like pulling the skin too much, so that also has a result in tissue damage, and sometimes you get hypertrophic scars. So like if you do periareolar and you try to put a big implant, sometimes you're like pulling a lot, and areolar tissue, it's usually much sensitive than like regular skin. So you should not like pull really hard the skin to put in the implant. So yeah, there has been a lot of change because of this technology, and now you have also the funnel, the Keller funnel, so you can put. It's like a plastic bag that it's filled with this how to say, like lubricant, and you put the implant, so you squeeze it in and it goes in faster and easier without pulling that much skin. Because like back in the day you would have like to pull really hard, and you're like putting the implant in with your fingers, and you know it's always more traumatic. So it also depends like what kind of brand you use. there are some brands that they don't have a lot of how to say mobility, and the implant is not really elastic, so it's harder to put it in. So it also depends on how big are you willing to have your incisions.
So that's funny you mentioned the funnel. Like that's very popular on like TikTok and like Instagram, where like surgeons are like showing this like no touch, there's no contact. It's just like it looks like
no touch.
and it's just like phew, and I can't help but wonder. You guys are plastic surgeons. Is that legit? It just seems like, hey, we're just like whipped cream, you know, like really.
Well, it's because there has been more evidence that shows that the more you handle the implant, the more you can have a capsular contraction. So the best way, it's like before you open the implant, to have any kind of liquid or something. Some use antiseptic, some use just like regular water, some use antibiotics or whatever. And you shake the implant, because there has like some electric negativity, like you could say. So when you open it, it attracts a little bit like the dust that it's like suspended in the OR. So the more you touch it, and the more you manipulate the tissue around the implant, the more likely you would have a little bit of biofilm or any other things that could interfere or affect the capsular contraction. Like everybody would have a capsular formation when you have an implant, but this could affect the amount of capsule you can have. And also that's something that I think that periroller incision has been not used that much, because since when you go through a periroller incision, you would have to cut a little bit of the breast tissue. And in breast tissue, you have the ducts, which are usually a connection between the gland and the outside skin. So you could find also bacteria in these ducts. So it can also have an implication with capsular contraction in the future. So I think that's why also surgeons have chosen more now the incisions like axillary or inframammary fold, where you don't have to go through the breast tissue.
Mm-hmm.
Does anybody here do the funnel technique?
I think everybody using funnel now, right?
Yeah.
Really? Everybody's doing the.
Yes.
You're using it too, honey?
Yes.
Oh.
Mm.
Oh, I thought.
I
Okay.
know. You never seen it. Maybe next time I'm gonna see you.
Yeah. I think it's much easier. Even if you touch the implant or not, I think it's much easier just to get it in, and it's less tissue damage. And like especially also if you want to have smaller scars, you have to adopt the funnel. And sometimes it can get like up to 1 minute if you don't have the funnel and you have small scar. Just 1 minute, like pulling the implant in and all that. So with the funnel, it's just like 10 seconds. You put it in and just like squeeze it, and it's done.
But I get it. For a round implant, for a smooth or micro textured implant. Yeah. But what about, are people still using the teardrop shapes? And if you're using,
globally, it is prohibited. Maybe it depends on the country. In Korea, it is prohibited.
The AA
in Mexico is not prohibited.
If you want, you can use it.
Yeah. In Mexico, you can use it, but especially like now, I think that people are using less the anatomic because the thing with the anatomic is to have a more natural shape. But now I think the best way to have a natural shape, you can have the breast augmentation with the implant and also do a hybrid procedure and do a little bit of lipofilling on the upper pole, and you will have the same result as anatomic implant, but you will not have these common problems that you could have with the anatomic, that was like the turning of the implant. And also, like from 5 years to now, the use of textured implants has almost like decreased to 0%. So if you have a non-texturized implant and it's anatomic, it's really probable that it's going to like shape and turn, and you can have like asymmetries or asymmetric breast in the future. So I think that's why people like don't use any more anatomic implants. But in Mexico, it's still you can get them, especially for breast like reconstruction maybe.
Okay, I wanna cover one more topic. It's already more than an hour. Let's cover one more topic. So one thing I want to say is, so we talk about the most popular brand is Motiva. So even in Motiva, I think I heard you said Mexico, you have mini, demi, full, and corset. Right?
Yes,
It's different in Korea. We only have a mini, demi, full.
Yeah.
What do you think? Are you using a lot of full, like a
no,
corset implant?
I actually don't like really much the corset, because with the corset you could never get a natural result. You would always have a really high upper pole, and it's always like notorious. You know, it's for somebody who wants like the round shape of the breast. But some people or some patients would ask for a corset. But I'm not really fond of that big implant, just full. And now we're talking about the projection, which is like what the patient get to choose, right? So yeah, but in Mexico there are many surgeons that only use, for example, corset. But it all depends on what type of patients do you have and what does the patient want.
So Dr. Go and Joe, what do you think? What is the most popular implant type, like among the mini, demi, and full?
It depends on the patient, I think, but I prefer to using demi. And I recently use increasing using mini, because it is good to balance the if there is a chest asymmetry, maybe we can use a mini and demi, and it is a little bit natural, more natural than using full and demi. So I prefer to using demi, but many people try to doing overcome their restrictions limit. So if she want to over than 350, so I should choose full type. But I have never used the course. I heard that it depends,
because it's not available in Korea.
Yes, maybe we should pre-order for 2 months before the surgery. I heard that.
Oh,
yes.
Okay. Dr. Go, what is your preference for the type of the implant?
I prefer demi, and sometimes I use full, but most of cases I use demi. But similarly, the mini is increasing because soft fascial plane is also increasing, and mini is a lower projection, has a low projection. So the patient who wants a more natural result and no prominent upper pole, I use a mini also. So it may be 70%, 60% is demi, and 20% is mini, and last of them is full, maybe.
Okay.
So actually, wait, no, sorry. I know we're getting long, and Eric, I'm so sorry. This one will be the last question. So Kyori and Dr. Go and Dr. Cho, actually, they were kind of part of this small group where they were doing a YouTube channel called Sasum TV. It's like 4 years or 4 plus, I don't know the pun. There's some pun about it. But one of the doctors who's not here, he actually specializes in Brazilian butt lift, right?
Okay.
No, Brazilian butt lift and literally fat grafting to the butt.
Okay, so
But it's different from the butt augmentation using implant.
oh, okay, so butts, especially his butts. So I'm curious because in like South America, the Latin population, they're very curvaceous. How often or how popular are like butt related cosmetic surgeries?
Yeah, like butt augmentation, it's really popular. Like usually, I could say that more than 80% of patients who are having liposuction, they want some degree of lipo injection in the buttocks or on the hips. But yeah, usually like Latinas and the stereotype of Latina is really curvy, but that doesn't mean like all Latinas are curvy. So usually the ones that are not curvy want to be curvy, and the ones who are curvy, they want to be more curvy. So yeah, that's a really common procedure in Mexico. Since we have a high index of obesity, it's really, well, it's not as popular breast like buttock implants, but usually you use buttock implants or a hybrid procedure, but with patients who are much more skinny and they just want a bigger butt. But yeah, it's much more common to have lipotransfer. But yeah.
Interesting.
Do you think in the Korean market, if you guys are doing liposuction anyway, like to kind of do a little filler, you're like, hey, extra service, we can add it to your butt. Do you think that would be an attractive service that women or people would be interested in?
Well, in Korea?
Yeah, in Korea. So for Dr. Cho and Dr. Go, do you think that's something people would be interested in?
Actually, who visit our private clinic, it is very thin and very slimmer persons, and they have the 78A cup, or some people have a AAA cup, so there is no fat layer.
We can harvest.
We cannot
But the
harvest.
thing
so
is,
it is
but I think comparing to the past, I think Korean population more like focused on the butt now than before. So if they can get a butt augmentation, I think they're willing to choose it. But the problem is we don't have much fat on their body.
Yeah.
But what a interesting flex, right? Oh, Korean people, we would get it if we could. But we have no fat. Like interesting flex.
Poor Koreans.
Right? Poor Koreans.
Yeah.
Oh, no fat.
Yeah.
But it has been. So we are wrapping up right now because it has been a little bit late. But is there any last words or comments from Dr. Cho, Dr. Go, Kyori, Eric? Anything you guys would like to share with anybody that watches this segment?
I don't know.
You don't want to add anything? Oh, first I want to say I really thank Eric.
Oh, no, it's a pleasure.
Come here sharing his experience, knowledge. I think this is really good. I want to do more of this because it's so interesting, not only for the plastic surgeon, but also for the patient too, because it's informative, still fun, and we can enjoy it. Anyway, thank you so much, Eric, and also
Thank you for having me.
like Dr. Ko and Dr. Cho joining us today.
So then I guess with that, if nobody else, anybody going once, going twice? Okay. No?
Thank you for sharing the
Thank you.
experience and the information about the Mexico plastic surgeons, and it was a very interesting time for me because I always curious about the other countries' plastic surgeon life. So it was very interesting. I heard that I envy you that you just have a social service for just 2 years, 3 years, 1 year. Yes.
Yeah, 1 year. Okay.
And Dr. Go, again, thank you so much for coming and joining. I know it's already 10, it's late for all the people in Korea, especially because you have to wake up early and open your own clinics tomorrow, and it's hard work. So again, Eric, thank you too for joining.
Thank you for having me. It was a great experience.
Please make sure my wife takes you out for a drink or something after this. And,
Yeah.
You guys, everybody have a wonderful night, and everybody, thank you so much for joining today or tonight. Thank you.
Yeah. Thank you. Bye-bye.
Thank you. Thank you. Thank you. Bye-bye.
Bye.
Bye.
Bye.